Assalamu alaikum everyone. In this video, we are going to discuss another acyanotic heart disease, that is atrial septal defect. As the name indicates that in this disease or the defect, there is a problem or hole is present within the interatrial septum. So if this hole or defect is present high in the septal region, it is due to defect in the sinus venosus. It is basically embryology, not going into the detail of this, but if it is in the middle portion or middle region, then the defect is basically present in the septum secundum, which is called ostium secundum ASD. So if it is in low in the septal region, this is called ostium primum. So this ostium primum defect is usually associated with the defects in the mitral valve as well, because of same origin from the endocardial cushions at the lower region in the septum. So the ostium primum defect is usually associated with the mitral regurgitation, but the most common type of atrial septal defect in 90% of the cases is ostium secundum defect. Now look at this diagram. As you can see here, in the interatrial septum, there is a shifting of blood from left atrium into the right atrium. And from the right atrium, when there is a volume overload, this blood from the tricuspid valve enters into the right ventricle. So there is a volume overload in the right ventricle as well. It leads to enlargement of the right ventricle and hypertrophy of the right ventricle, and there is a shifting of this blood into the pulmonary circulation. So as a result, at the later stages, the pulmonary hypertension develops in these patients along with the right ventricular hypertrophy. So this is basically atrial septal defect. Now come to the clinical features. Most of the patients are asymptomatic. There are no sign and symptoms, and usually picks on the routine examination, physical examination. But in older children, varying degree of the exercise intolerance may be noted, and there is systolic murmur at upper left sternal edge. The most important thing here to be remembered is fixed splitting of the S2 heart sound. As we know that S2 heart sound has two important parts. One is A2 and the second component is P2. A2 is for the closure of aortic valve and P2 is for the closure of pulmonary valve. So due to the large volume of blood in the right ventricle, there is little bit delay in the closure of the pulmonary component. So there is fixed splitting of second heart sound. It means that after the A2 component, there is little bit delay in the development of P2 component. So this is called fixed splitting of second heart sound. This feature is very important. As we have discussed previously, these all are the features of the ostium secundum defect, which is the common one. But in the ostium primum patients, sometimes there is recurrent infections of the chest, like the patient has pneumonia and fatigability and irregular exercise intolerance. These features are because of mitral regurgitation associated with the ostium primum defect. Now come to the diagnosis, that how we can diagnose. For diagnosis, first step is chest x-ray. Chest x-ray shows increase in the pulmonary vascular markings because of the pulmonary hypertension due to volume overload in the pulmonary circulation, and there is sometimes rarely cardiomegaly can be seen because of right ventricular hypertrophy, but this is not prominent feature in the x-ray. The next step in the investigation is electrocardiogram, that is ECG. It shows the partial right bundle branch block. This is due to right ventricular hypertrophy can lead to this bundle branch block on the right side of heart, and there is right ventricular hypertrophy. This is due to volume overload. The definitive diagnostic test is echocardiogram, and it basically determines the location or the exact shows exact where the pathology is in the atrial septum. So this is the most important test for the diagnosis of ASD. Now come to the treatment. No specific treatment is required, but in the septum primum defect, that is ostium primum, the defect, so the endocarditis prophylaxis antibiotics are necessary because of the risk of endocarditis in these patients because of associated mitral regurgitation. Surgical treatment is needed in all the symptomatic children and in all the asymptomatic children with the shunt ratio of more than 2:1. So what is this 2:1? It means that the pulmonary circulation is 2 times higher flow than the systemic circulation because of the high flow into the pulmonary circulation. So if the shunt ratio is 2:1, means that the pulmonary circulation has high flow than the systemic circulation, then surgery is indicated. It is usually surgery is done before going to the school. So this was whole about the atrial septal defect. Let's end this lecture with this scenario. A 7-year-old boy presents with the exercise intolerance, having the prominent precordium. There is a loud S1 and fixed and widely split S2. This feature is very important. Fixed, widely split S2 sound at the upper left sternal border. So what is the diagnosis in this case? This patient has atrial septal defect. The investigations in this case are chest X-ray, ECG, and echo. The definitive test is echocardiogram. And the management, no medical management is necessary, but in the septum primum defect, the endocarditis prophylaxis is needed. Otherwise no medical treatment, surgical correction is the only option in these patients. So this was whole about the atrial septal defect. Thank you so much for watching this video.